Good morning. Or maybe you're watching this in the afternoon or late at night. But think about your morning for a second. That first hour after you wake up. Your feet hit the floor. Maybe you start the coffee maker. Maybe you're already thinking about breakfast before you've even brushed your teeth. Here's something that surprises almost everyone. Somewhere between 40 and 50% of heart attacks and strokes happen between 6 in the morning and noon, not at night, not during a stressful afternoon. In the morning, often during the exact routine you've done the same way for years. Most of us think of mornings as the fresh start part of the day. You slept, you rested, your body recovered, so shouldn't this be the safest time? For many people, yes. But if you live with hypertension, your body goes through a uniquely vulnerable transition right when you wake up. And a few ordinary habits, the ones so routine you don't even think about them, can make that window a little riskier than it needs to be. I want to be clear. This video isn't here to scare you. It's not here to tell you coffee is dangerous or that breakfast is out to get you. It's here to explain, in plain language, what's happening in your body first thing in the morning, why that matters if you have high blood pressure, and what the research actually supports for protecting yourself during this part of the day. By the end, you'll understand why blood pressure naturally shifts overnight and into morning, why that shift matters more for some people, and the specific everyday habits that can either support your treatment or quietly work against it. Medication timing, coffee timing, breakfast sodium, and even a common pain reliever you might reach for without thinking twice. None of this is about fear. It's about understanding your body well enough to work with it instead of against it. Let's start with the science. Let's talk about why blood pressure changes so much overnight and into the morning. Your body runs on a circadian rhythm, your internal biological clock. It regulates hormone release, body temperature, digestion, and blood pressure on a roughly 24-hour cycle. Your cardiovascular system doesn't run flat all day and night. It rises and falls in a predictable pattern. Here's something many people don't realize. During healthy sleep, blood pressure is supposed to drop. Doctors call this nocturnal dipping. In a healthy pattern, blood pressure falls around 10 to 20% while you sleep compared to daytime numbers. That nighttime dip gives your heart and blood vessels a period of rest. Lower pressure at night means less mechanical stress on vessel walls, including the inner lining called the endothelium, which uses this quieter period for recovery. As you move from deep sleep toward waking, your body doesn't flip a switch. It ramps up before your eyes even open. Your adrenal glands release more cortisol, often called the stress hormone, though it's really more of a built-in alarm clock hormone that mobilizes energy and sharpens alertness. At the same time, your sympathetic nervous system, the fight or flight system, becomes more active. Adrenaline increases, heart rate picks up, blood vessels constrict slightly, and blood pressure, at its lowest point during deep sleep, begins climbing quickly in what researchers call the morning surge. This is where the science becomes important for anyone with hypertension. In someone with healthy blood pressure, this surge is normal and well controlled. But in people with hypertension, especially uncontrolled hypertension, the baseline is already higher, so the surge on top of it can push numbers into a riskier zone. Vessels that already show some wear are less able to buffer that sudden rise smoothly. Some people with hypertension don't get the healthy nighttime dip at all, called being a non-dipper, and research links this to higher cardiovascular risk over time. So simply put, your body is designed to rest at night and ramp up in the morning. That's normal. But when the starting point is already elevated because of hypertension, that ramp up becomes a bigger event for your arteries and heart. Now let's talk about why this matters for heart attacks and strokes specifically. Many seniors don't realize that plaque buildup inside arteries, atherosclerosis, isn't a static pile sitting quietly in a vessel. These plaques can be unstable, especially older ones, and research shows they appear more vulnerable to rupture during morning hours, when rising blood pressure, heart rate, and sympathetic activity put more mechanical stress on artery walls. When a plaque ruptures, The body tries to seal that injury the same way it would a cut on your skin, sending platelets and clotting factors to the site. Normally, that's protective, but inside a coronary artery feeding the heart or a vessel feeding the brain, that same clotting response can block blood flow. In the heart, that's a heart attack, a myocardial infarction. In the brain, that's an ischemic stroke, the most common stroke type. Higher pressure means more force against artery walls. More force against an already narrowed or plaque-affected artery raises the chance a vulnerable area gives way. Combine that with the body's naturally increased clotting tendency in early morning, also documented in research, and you can see why this stretch of the day carries a disproportionate share of cardiovascular events. Understanding this isn't meant to make you anxious every morning. It's meant to help you see why the habits we're about to cover genuinely matter. And almost everything ahead is something you have real, practical control over, working together with your healthcare provider. Let's talk about the single biggest mistake people often make with blood pressure medication in the morning. If you take blood pressure medication, timing matters more than most people realize, and inconsistency is often a bigger problem than a single missed dose. Remember that natural morning surge driven by cortisol and adrenaline. Many medications are timed by your doctor specifically to have their peak effect covering that window, helping blunt the surge. When a dose is delayed, forgotten, or taken at wildly different times, you can create a protection gap, a stretch when the medication's effect has worn off or hasn't kicked in yet, right when your body's natural rise is happening. This connects to a medication's half-life, how long it stays active in your bloodstream at an effective level. Your doctor selects your specific medication and schedule based on that profile and your health picture. Some medications are once daily precisely because their effects last through a full 24-hour cycle, including the morning surge. When doses are late, skipped, or uneven, that carefully designed coverage develops gaps. Research and clinical experience consistently show it's usually not one missed dose that creates serious danger. It's the pattern of inconsistency over weeks and months that erodes control. Taking medication at 7 a.m. one day, 11 a.m. the next, skipping days, then doubling up to catch up, creates an unpredictable roller coaster instead of the steady control your treatment was designed to provide. A few practical strategies help. Anchor your medication to something you already do every day without fail. Brushing your teeth, starting the coffee maker, sitting down for breakfast. A pill organizer with day-by-day compartments removes the guesswork of, did I already take this? And makes it obvious if you've fallen behind. Phone alarms help too, especially with multiple medications on different schedules. And if you notice yourself consistently forgetting doses or running out before your refill, that's genuinely worth raising with your doctor or pharmacist. They may be able to simplify your regimen. Never stop, start, or change your blood pressure medication, including timing, without speaking with your healthcare provider first. Even well-intentioned changes should be discussed with your doctor or pharmacist, since they know your specific medication and how it interacts with everything else you take. Now let's talk about coffee, something almost everyone with high blood pressure has wondered about. Caffeine works partly by blocking a molecule called adenosine, which normally relaxes blood vessels. Blocking it can cause mild vasoconstriction along with increased alertness, which is exactly why people drink coffee. This, combined with caffeine's stimulating effect on the nervous system, can cause a temporary rise in blood pressure, especially in people who don't drink caffeine regularly. For most people, this effect is modest and temporary, and research on regular, moderate coffee drinkers hasn't generally shown the sustained, long-term increase some people fear. Some research even points to potential cardiovascular benefits from moderate coffee consumption. Coffee itself, in moderate amounts, isn't the enemy. But timing matters because of that morning surge. If you drink coffee during the exact window, your body's own stress hormones are already pushing blood pressure upward. You're stacking caffeine's temporary effect right on top of your natural morning peak. For someone with well-controlled hypertension, this usually isn't dramatic. But for someone whose blood pressure runs high or who hasn't yet taken their medication, that stacking can push numbers higher during an already vulnerable window. This is why some providers suggest patients with hypertension have coffee after, not before, their medication has had a chance to start working, often discussed as a gap of around 20 to 30 minutes, though the ideal spacing depends on your specific medication and doctor's guidance. This isn't about fearing coffee. It's a simple, low effort sequencing adjustment to a routine you already have. Now let's talk about breakfast, specifically sodium, something that catches a lot of people off guard. Sodium's relationship to blood pressure comes down to fluid balance. Your body keeps sodium concentration in your blood within a tight range by retaining more water alongside it. More retained water means greater fluid volume circulating through your vessels, and greater volume pushing through the same sized vessels generally means higher blood pressure. This is one of the most well established relationships in cardiovascular medicine, which is why the AHA, CDC, and virtually every major health organization recommends limiting sodium for people managing hypertension. Breakfast for many Americans is quietly one of the saltiest meals of the day, and most people don't realize it because breakfast doesn't taste as obviously salty as, say, chips. Think about a typical plate: bacon or sausage links, salted butter on toast, processed cheese on eggs, or a fast food breakfast sandwich, which can sometimes contain close to, or more than, half a day's recommended sodium limit in a single item. The saltiness is often masked by fat, smoke flavor, or sweetness, which makes it easy to underestimate. This isn't about strict dieting or never enjoying bacon again. It's about awareness and having go-to alternatives. Lower sodium breakfast choices include eggs prepared without much added salt, fresh fruit, plain oatmeal flavored with cinnamon or fruit instead of salt, plain yogurt, whole grain toast, and unsalted nuts if appropriate for you. These give real variety and satisfaction while keeping morning sodium load and the fluid retention that comes with it more modest during an already vulnerable window. A simple habit: glance at the sodium line on packaged breakfast items. You don't need to become an expert, just build the habit. Now let's talk about something that genuinely surprises people. Certain everyday pain relievers can interfere with blood pressure treatment. We're talking about NSAIDs, non-steroidal anti-inflammatory drugs, including common over-the-counter options like ibuprofen and naproxen, and prescription-strength versions like diclofenac. These are medicine cabinet staples, often reached for without a second thought. NSAIDs can affect the kidneys in a way that promotes sodium and fluid retention, similar in effect to dietary sodium, leading to increased blood volume and elevated blood pressure. Regular NSAID use has also been shown in research to potentially reduce the effectiveness of certain blood pressure medications, including some diuretics and ACE inhibitors, by interfering with kidney processes those medications rely on. This doesn't mean NSAIDs are forbidden. Millions of people use them safely for occasional aches. But if you're managing hypertension, this is worth a conversation with your doctor or pharmacist, particularly if you reach for NSAIDs regularly for chronic pain rather than occasionally. Acetaminophen, the active ingredient in Tylenol, is sometimes considered an alternative because it works differently and generally doesn't carry the same sodium retention concerns. It has its own considerations too, including limits related to liver health, and should also only be used as directed and discussed with your provider, especially if you take other medications. The takeaway isn't avoid all pain relievers. It's don't assume over-the-counter automatically means no interaction with your treatment. A quick conversation with your pharmacist, one of your most accessible resources, can clarify what's appropriate for you. Let's talk about something tying everything together: consistency. If there's one theme running under everything we've covered, medication timing, coffee timing, sodium, NSAIDs, it's this: your cardiovascular system responds far better to steady, predictable patterns than sporadic, all over the place habits. This is exactly how your doctor evaluates your control in the first place. A single reading, even a slightly elevated one, doesn't tell your doctor much on its own since blood pressure naturally fluctuates with activity, stress, hydration, and the morning surge. What matters clinically is the trend over days, weeks, and months. That's why many doctors recommend home blood pressure monitoring. A basic monitor combined with a simple log, notebook, app, or a chart your doctor provides gives you and your care team a clearer picture than any single office visit. Ask your doctor about the best time of day to measure and proper technique, since sitting position, arm placement, and even talking during the reading can affect accuracy. If you get one unusually high reading, try not to panic. One number is a data point, not a diagnosis. What matters is whether it's an isolated blip or part of a pattern. If you're ever unsure or a reading is significantly elevated along with symptoms like severe headache, chest pain, shortness of breath, or vision changes, seek medical attention promptly rather than waiting to see how it trends. Pill organizers, phone reminders, consistent meal timing, and a stable daily rhythm all serve the same purpose, removing guesswork and randomness so your treatment plan can do what it was designed to do. Now let's put this together into a realistic, safe morning routine. You wake up. Before anything else, take your medication as prescribed, ideally at a consistent time established with your doctor. If appropriate for you, drink a glass of water, which supports healthy hydration. Your doctor or dietitian can advise on what's right for your specific needs, especially if you manage conditions like kidney disease or heart failure, where fluid intake needs closer attention. If you drink coffee, consider waiting roughly 20 to 30 minutes after your medication before that first cup, letting treatment begin working before adding caffeine, aligned with what your own doctor recommends. For breakfast, aim for a balanced plate. Protein, fiber, fresh produce where possible, while being mindful of sodium-heavy staples like processed breakfast meats, salted butter, and processed cheese. Small, sustainable swaps add up over time. If your doctor has approved light activity, gentle morning movement, even a short walk, can support healthy circulation, always guided by what your provider considers safe for you. If you monitor blood pressure at home, morning is often a convenient, consistent time, following your doctor's recommended technique so readings are accurate and comparable day to day. And finally, don't overlook stress. Mornings can be rushed. Even a few minutes of calm, slow breathing, sitting quietly with your coffee, light stretching can meaningfully support your nervous system as it transitions out of that heightened morning surge state. None of these steps require dramatic changes. They're small adjustments to a routine you already have, working with your body's natural rhythms instead of against them. Let's bring it all together. We started with a fact that surprises people. A large share of heart attacks and strokes happen between 6 a.m. and noon. We talked about why your circadian rhythm causes blood pressure to dip during sleep and surge as you wake, driven by rising cortisol, adrenaline, and sympathetic nervous system activity. For well-controlled blood pressure, this surge is normal and manageable. For hypertension, especially uncontrolled, that same surge places more stress on already vulnerable arteries, part of why cardiovascular events cluster during this window. We covered the habits that matter most, taking medication consistently at the time your doctor recommends rather than letting timing drift, being thoughtful about coffee timing relative to medication, watching for sodium hiding in ordinary breakfast foods, understanding that NSAIDs can interfere with blood pressure control and are worth discussing with your pharmacist if used regularly, and recognizing that consistency, steady routines, home monitoring, simple tools like pill organizers often matters more than any single perfect day. Questions worth asking at your next appointment. What time of day should I take my blood pressure medication? Anything about my specific medication regarding food, caffeine, or NSAIDs I should know? Would home monitoring help me, and what technique and schedule do you recommend? Are there warning signs specific to my history that should prompt urgent care? It's worth knowing the general warning signs for urgent attention: sudden chest pain or pressure, shortness of breath, sudden severe headache, sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, or sudden vision changes. If you or someone with you experiences these, that's an emergency services situation, not a wait and see one. Understanding your body isn't about living in fear of it. It's about partnership, working with your own biology and your healthcare team instead of feeling like your body is unpredictable. The habits we covered today are small, realistic, and grounded in genuine, well established science, not gimmicks. And as always, never stop, start, or change your blood pressure medication or routine without speaking with your healthcare provider first. They know your full picture and are your best partner in making any of these adjustments safely. Thank you for spending this time with me today. Take care of yourself, and I'll see you in the next video.